General Rob Stahl. I'm the commander for the 108th Training Command Initial Entry Training located in Charlotte, North Carolina. As the president for a small hospital in a very large enterprise system, the Cleveland Clinic, and as the commanding general of soldiers who are training forces in Afghanistan, Iraq, Horn of Africa, Saudi Arabia, the biggest challenge in healthcare, really, and in actually providing information is the movement of information, whether it's around the battlefield and back into the unit aid stations, into Landstuhl, and then back to the States, or it's in a small community hospital that is moving information throughout an enterprise system with 9 other regional hospitals, 18 family health centers, and a 180-acre complex located in Northeast Ohio. What's important is to capture the information from the patient and to provide it so that everyone that subsequently touches the patient, whether it's a specialist, whether it's a surgeon at Landstuhl or back in the States, has as much information as they can have, given the fact that that soldier or that patient comes in from a point, whether it is Afghanistan or whether it is Medina Hospital. When that patient moves around, all of that information, is longitudinal and is portable, where that information stays with that patient. That sounds a lot easier than it actually is. We've been dealing with paper records. We've been dealing with modalities where labs haven't been attached, or radiologic images haven't been attached, or the pharmaceuticals, pharma that has been given to patients. When that patient is seen by the next specialist, that specialist starts from scratch in determining what needs to be done for the patient. That longitudinal care, that electronic medical record that's being developed both on the civilian side as well as in the military side with the things that we're doing now, is very important for where we're going in the future with healthcare. In the past, whether it's Desert Storm or something even more recent, that soldiers had a paper record. A lot of times that soldier came off the battlefield and was seen at the unit aid station. By the time they got to Landstuhl or by the time they get back to the States, the physicians and the specialists that see that soldier did not know what had already been done to the soldier. With ALTA, which is the current electronic medical record, with TMDS, we now, once that soldier gets on the medevac, the actual documentation begins, and that documentation, then there is a continuity of that documentation all the way through the system, so that when that soldier arrives at Landstuhl back in the States, or moves on and goes into perhaps the VA system, there is longitudinal knowledge of what has been done to that soldier, or what that journey of that soldier looks like, so that the specialist picking up that soldier can determine the best course of action for that soldier. It's interesting, and it's about the same. Both in the private sector and in the military, it's that continuity that we need to develop. Right now, we have systems that that may not be talking to one another, or talk to each other in part, but are missing pieces. What we need to get to is systems that provide that prompt the specialists, the extenders, the physicians all the way through in asking the right and appropriate questions. Also that, that we have consistent quality as we bring our soldiers and our patients, through any system. It sounds intuitive, but it hasn't been done quite the way we need to do it here in the future. Certainly with the American Recovery and Reinvestment Act and HITECH on the civilian side of the house, we are putting some of those pieces together. And again, there's a balancing act, there's a security balancing act, but there's a communication that has to be there so that we get the right information about the right patients to the right people at the right time. What's holding healthcare providers back from implementing current healthcare solutions is a legacy of the past. It's certainly holding on to the way we've done it in the past, the efficiencies we had, the ability to control our own destiny. But more and more, some of the current legislation, some of the current things in HITECH, as well as the American Recovery and Reinvestment Act, are going to drive meaningful use. And meaningful use is going to, in part, determine how we're going to do things in the future. I think physicians who are incredibly busy already with their own practices are, the challenge is going to be to find the time or to reach out to larger organizations, larger enterprises, hospital systems, to partner with them to help them through this time. In the military, we have the opportunity to to hook all of these systems together. Certainly with ALTA, that's it's been done. An electronic health record through all of the armed forces. We are on the path. It's difficult. A lot of people don't like the current health record. But we're working at it, and we're chipping away and making it easier use, more meaningful use, as well as getting it to interact with web-based systems like the TMDS system that we have out on the battlefield today. We are working, today we have an operational reserve. We have, I believe the number is almost 65,000 soldiers that have been mobilized and deployed as part of the active component. We are working very hard, very diligently on making sure that our Army Reserve soldiers and the families that have the very best that we can provide them, both overseas, wherever they mobilize, deploy, and are providing defense for our country, and their families who are back here. And so it's a degree of comfort that we can give them to put the very best in medical technology, and also the current medical electronic medical records that we have in use to provide the very best for our soldiers and